we touched upon this before, but we want to talk about it again. The number 2 way to prevent a medical mistake from happening to you is knowing your medications. I cannot tell you how many times, and this is not a patient's fault because I don't think we emphasize it enough to our patients. You should know each and every medicine you're on, each and every supplement, each and every vitamin. You should know the dosages. You should know how often a day you take them. The wrong medication or wrong dosage injures 1.5 million people per year.
You know, there was a Harvard Medical School study that looked at if somebody's on 5 medications, maybe taken throughout the day, there's 3,000 different combinations of shapes and colors of those pills. If you took one and you couldn't remember if you took that one, you know, okay, I'm going to take the second one. It can get really confusing. You need just to have a good, simple system to remember to keep the right combination.
Right, not to take too much or forget it altogether.
We all have smartphones.
Yeah.
Right. Most people have smartphones. You can do 2 things with your phone. You can take pictures of your medications, your medication labels, even the pills themselves so that you familiarize yourself with them. The other thing you can do, very simple, in this case it's just 3 medicines, but keep a little note of all the medicines that you take, the dosages, and how many times you take it per day. You can literally get to the ER or the doctor's office, hand this.
Yeah, this is what I'm on.
And boom, you're good to go. And then if you're at the doctor and any of this changes, make sure this is up to date because even with great electronic medical records, they are not always up to date. And we are not always the best at updating them. You may come in, get a new medication, a new dosage, and someone forgets to put it in the system.
Right.
That happens.
Yeah, and I'm always amazed how people pay so much more attention to other things, you know, your kids' schools, which is obviously very important, the closest grocery store, but when it comes to our own health, it's almost like a lot of people want to put that in a black box. That's for someone else to deal with. But just some basic stuff like you're mentioning can make a huge difference in the ER or the OR.